We have Dr. Ben Bocchichio online right now. Thanks for joining us.
My pleasure, Mark.
So Dr. Ben, in 1978, the New York press called you the guru of fitness. We were just talking about how there weren't too many gurus back then.
Yeah, no, I was, one of the only guys. Don't forget that's 45 years ago, just about. There weren't that many guys who actually did, physical exercise prescription and also had academic background. Most of the guys either had gyms or you had guys in universities doing, rodent studies or whatever. So I was kind of like the guy who seemed to know a lot of stuff and could actually make it happen, make it work in real clinical practice.
And what is your background specifically? So I met you here in San Diego, and we host these low carb meetings here once a month, at least before the quarantine and stay at home orders. And
Right.
your talks that I've listened to, your training has really focused around the metabolic effects of exercise, which is to me really fascinating because a lot of trainers or physical therapists or people who teach exercise do it either for weight loss, they do it for fitness, or they do it for injury recovery or rehab. And so, but you were specifically talking about like the metabolic effects of exercise. That's what stood out to me. So what is your background and what is your training methodology?
Background is, a BS and phys ed health and science, MED, master's degree in um, emphasis in kinesiology, PhD in exercise, muscle phys, and a PhD in health. So, but my philosophy, the reason you mentioned metabolic stuff, and most people do weight loss or something else, but all that stuff is really metabolically induced. So, my first doctoral thesis was on the metabolic effect of mechanical work. Okay, and how mechanical work and metabolic response really, either was aerobic or anaerobic or strength building or endurance building, has to do with what chemistry is induced by the mechanical work selection, the muscle fiber recruitment selection, how you recruit muscle fibers, in what frequency, what duration, what intensity, things like that. So that's really the benefits of exercise have thing to do with how we manipulate muscle fiber recruitment, the different kinds of way we can tax muscles with a specific intention. I mean, exercise is really a formal prescription. We need a specific intention of what we are trying to do and accomplish metabolically or chemically, so that we can induce the responses that we are trying to induce, whether it be like you said, anti-inflammatory responses, whether it be hypertrophy or strengthening around joints for rehab, whether it be anti-inflammatory pathways that we can induce through mechanical work. So if you understand how to manipulate the muscle system, and one of the big talks I'm going to give in the summer is the power of the muscle system, in the metabolic realm. Okay, how many things we can do and how powerful this system is, kind of underrated. When we probably were taught about the muscle system, it was kind of mechanical, and you could strengthen it and helps bones and stuff, but the powerful signaling capacity of the muscle system as an endocrine organ, or a paracrine, or an autocrine, meaning it sends these chemical signals to modulate the same cells that are similar, or the whole body, which would be an endocrine kind of a response, chemical to the muscle action. So that we were not taught, and that's kind of stuff that's come up in the last maybe 15 years or so. But I've been ahead of that curve a little bit, understanding that it's a very powerful system. In fact, it's probably the most generative system, understanding that your respiratory system, your cardiovascular system, your nervous system, your skeletal system, all respond to the generation of the stimulus of muscle action, of the muscle system. Those are all support systems. The muscle system is the actual generator of all those actions and all the health levels of those different systems.
Yeah, that's really fascinating because if you take something like cardiovascular training, you think that's good for your heart. That has cardiovascular benefits to lower cholesterol, can help with diabetes, help with heart disease. But are you talking just specifically about one type of exercise, or are there different forms of training that you're talking about?
Well,
Because you mentioned if you're stimulating a muscle, I would immediately think strength training.
well, no, when you're jogging, when you're running, when you're swimming, you're stimulating muscle fibers in a certain sequence at a certain intensity for a certain duration. Okay, so no, I'm talking about any muscle action that's intended, or even if it's recreational, that the format, the elements that comprise that muscle stimulation um, will dictate what kind of metabolic responses and what kind of mechanical responses you're going to get. In my mind, that you're a PT, you've got a good background in a lot of this stuff, but what I see as a shortcoming, not just in your field, but in any of these fields that use exercise in quotations now, is that they're not understanding that the mechanical benefits are derived from instigating these metabolic responses, whether it's muscle building, whether it's recovery. And if you talk about cardiovascular, if you talk about cardiovascular exercise, to me, the cardiovascular system is always taxed. And if it's cardiovascular aerobic exercise, if we're going to go technical on this a little bit, then the best cardiovascular exercise, the best exercise we can do for the heart, the health and the function of the heart and the blood vessels is really high intensity exercise. And there are a bunch of pathways that we can induce, that you can induce by steady state exercise. It doesn't happen. So for the actual response for fat burning, for cardiovascular health, I mean, you have to recruit the type 2B muscle fibers, and there's a bunch of ensuing responding pathways that I can verify and explain to you as to why they're more aerobic, they're more cardio than conventional cardio.
What seems to provide more benefits in terms of metabolic effects? Is it high intensity interval training or steady state exercise? Or is that something
Okay.
that is really similar?
No, it's not. Okay, so high intensity interval training, okay? And I parse that definition this way. High intensity interval training, if you think about what you're stating in that little, in those 4 letters, if you are doing high intensity training, it has to be by nature interval. You cannot sustain high intensity exercise. Can't do it. Not real muscle fiber recruitment high intensity. Now, some studies call working, at 85% plus VO2 max as high intensity. That's not really a true definition. That's a running kind of comparison of exercise. Exercise that's true high intensity recruits the glycolytic type 2B muscle fibers. Okay, that's what actually develops and is the foundation of high intensity exercise. It has all to do with muscle fiber recruitment and other kinds of, exertion of effort, difficulty, sweating, exhaustion. All those things are descriptions of certain characteristics of these exercises, but they do not define what high intensity exercise is. It may be any of those or all of those things, but that's not what defines it. What defines it is the muscle fiber recruitment and the way we recruit those high intensity glycolytic life or death muscle fibers. That's high intensity.
And how does that contrast with the steady state exercise?
Okay, steady state exercise by definition is that exercise which makes the least inroad or does the least amount of harm or imposition on the metabolic system. So what does that mean? It means by definition, it is not meant to upset or direct an upward response in our metabolic condition. It's meant to be sustained on a very efficient manner. Okay, so steady state by definition is not very stimulatory for any increased functional or metabolic capacity. It's the state that we were in as a developing human species to maintain movement at a very modest use of energy. We conserve energy by doing steady state exercise. Okay, so it's great for the survival of the species. It's awful for trying to produce metabolic or functional change, because it by definition, steady state means we're not rocking the boat. We're staying where we are. We're staying within the capacity. The brain doesn't assume that we're going to have to upwardly adapt as a result of being exposed to this steady state, because we can handle it. If you can handle steady state, there's no need to adapt upwardly. Okay, so understand those real true definitions and delineations. And again, it has all to do with which muscle fibers we are stimulating or recruiting, and what are the energy systems that they use, and what are the metabolites or the byproducts that they produce. That's what's going to determine the effect of the exercise. So in my book, you'll see I have fat borrowing versus fat burning. So when we're in a steady state or in a rested state or in a very mild level of exertion state, we have free fatty acids and triglycerides circulating in and out of those two forms. Right now, as we're sitting talking, that's happening, okay? That's free fatty acids are usable energy. They go into a storage mode, or triglycerides come out of it, and we're cycling that as our metabolism is working now at a kind of a basal or resting state. Okay, when we do steady state exercise, we borrow from this existing cycle that we're having happen right now. We borrow from it, we create a deficit, and at the end of that routine, at the end of that quote exercise, I call it activity bout, what happens? Metabolism slows down and we get hungry. So we eat a little more and then we slow down our metabolism. Net effect of that, Mark? Zero. Okay, so if you want to burn fat, you want to lose weight, steady state exercise has been proven, even documented by the American College of Sports Medicine, which was founded by marathon runners, to be ineffective.
And I was just about to bring that up. That's feedback that I'm sure you've received when clients are going to start to work with you, or I'm working with somebody with an injury and they're expressing frustration with their workout routine, or they say that they go to the gym all the time and they can't lose weight, or they can't burn, they say they can't burn fat. And they describe their routine to you and it's describing steady state exercise. They might be doing 30 minutes of the same intensity on the treadmill. No variation over a period of time.
No variation, and probably not much. I mean, unless you are recruiting these muscle fibers, and if you recruit the muscle fiber types to which I am referring, you cannot sustain it. Certainly, you can't steady state it. Doesn't happen. Okay, because what we're doing, we're building up lactic acid to the point where we can't aerobically steady state replenish it. So we have to do one of two things: we have to stop, or we have to slow down. Okay. So can you do intervals? Yeah, interval training is much more effective because of the muscle fiber recruitment pattern. Okay, but steady state exercise is very futile, and most people get discouraged because on the machine they're on it says this is a fat burning mode. Okay, while it's true that most of your fuel comes from fat, the amount of fuel is negligible. When we do high intensity exercise, more of a percentage of fuel comes from glycogen and less of a percentage comes from fat, but more objectively, more total fat is burned doing high intensity exercise per unit of time than it is by doing what we call traditional fat burning. So there's and it's exercise physiology is taught in most of the textbooks. This is very misunderstood, misrepresented, and I don't think it's really understood by the people that are supposedly experts in this field much. Some of them understand it by now, but and we can just go over some of these pathways and things like that. But needless to say, that you cannot burn stored body fat unless you do the steady state exercise for huge lengths of time. Okay, you're always going to prefer to burn glycogen, and if you're burning glycogen at the rate steady state exercise burns it, it'll take you 2.5 hours before you get to fat burning from stored body fat. So you can do, if you'd like to, 2.5 hours on a daily basis, in which case you'll be dead in 10 days. Or you can do 15 minutes of high intensity exercise a couple times a week and get much more bang for your buck.
So I have your book right now. It's 15 Minutes to Fitness, Dr. Ben's S.MA.R.T plan. And what is the S.MA.R.T plan? You talk about it in your book. I've heard you speak about it before.
Yeah. The S.MA.R.T plan is a cutesy acronym for slow, maximum response training. Okay, so what it really is I created slow resistance training in 1973. Okay, I started as a formal exercise method, and the reason I did it was I wanted to work at a high intensity. I knew instinctively and from observation that was the most beneficial exercise for endurance, for strength, for performance. But I also knew that mechanically most conventional high intensity routines were very, very damaging. Okay, heavy weights, explosive movements, catching the weight, crazy positions. So that was traditionally what high intensity exercise was all about, and that's what we knew. So I said, how do I get the benefit of the high intensity effort, exercise, muscle recruitment, and not kill my joints, basically? So if we understand that force is mass times acceleration, and acceleration certainly has a speed factor involved in it, then if we reduce the acceleration, or we basically in real terms reduce the speed, then we can reduce the mechanical benefit and actually enhance the metabolic benefit to the muscles that we're trying to work. So, and it's also very, very, it's disciplined, it's safe, it's universally applicable for rehab patients, 2 days out of surgery, or world-class athlete, or beginners, or kids, or 95-year-old. I got lucky in that the system that I chose to be the most intense work possible originally for elite athletes turned out to be the best of all worlds for many different applications, one of which was a rehab. I started doing orthopedic rehab and cardiac rehab after I was 6 months in business. People were starting to send me people. And then I actually owned a cardiac rehab and diagnostic center, and we applied high intensity exercise, again, relative, high intensity is a relative term, to my phase 2 cardiac rehab patients who were on telemetry, okay, after heart attacks. And we got much better results because the heart really is dependent on the muscle system to deliver energy. And if the muscles are more highly functional, they put much less stress on the heart, which is now infarcted or it is compromised after a heart attack. So really, what we're trying to do with almost all of these rehab, even I would venture to say a lot of orthopedic rehab, is we're trying to strengthen the muscle system, which is of course attached to the attaching system, the tendons and the ligaments, and through that modality, and the bones, through that modality of muscle fiber recruitment, we can benefit all these other tissues and organ systems.
Yeah, I wanted to talk a little bit about the going off of the musculoskeletal injuries.
Yeah.
And if somebody is having chronic pain or persistent pain from sciatica or from a tendinopathy or a tear that might be old, like a meniscus tear, or irritation or breakdown of cartilage. So how could this form of training help with that? What are some of the metabolic effects, so to speak, for those conditions?
All right. First of all, you know this better than I do, that a lot of the integrity of any joint that has a compromised meniscus or laxity in the tendons, ligaments, scar tissue, but about 70% of the integrity in most joints is muscular. Okay, so if you work from that premise that it's tough to strengthen or really shorten, stretched, beyond repair kind of attaching system tissue. What we have left at our disposal, other than surgery and some rehab, but rehab is almost always muscularly induced, right? You're trying to muscularly induce the response to the attaching system, by the attaching system, to that muscle stimulation. But so if we can strengthen the muscles around the joint, for example, you talk about sciatic. Okay, sciatic. There are a lot of people that have piriformis problems, tightness, spasm, or the sciatic nerve actually in some people runs through the piriformis. So now you have an issue with posture being irritating and things like that. So if we can strengthen, stretch, improve the function of those muscles, okay, we can help alleviate the problem. And most of the problem has to do with pain and spasm, a lot of spasm. I think the sequence in a lot of sciatic patients that I've seen over the years is number 1, fatigue, number 2, spasm, number 3, pain. Okay. So what does fatigue mean? Fatigue means we've superseded the capacity of that muscle to handle whatever it is, the load that we're giving to it. So if I can increase the capacity of that muscle to withstand the load, I reduce the likelihood of going into spasm, fatigue, spasm, and pain. Okay, it doesn't cure it, but it certainly goes a long way as an adjunct, certainly, to modalities that you might use, or pharmaceutical modalities, or muscle relaxers, or whatever, at least acutely, at least initially, right? So I think, the other thing, anti-inflammatory. I did a study, or structured a study with Johns Hopkins University on juvenile idiopathic arthritis, JIA kids. These kids hurt all over. The joints hurt, the muscles hurt. As a result, they don't do anything. They don't move because moving hurts. As a result of not moving, they get diabetes, They get osteoporosis, at really young ages. So what do we do with these kids, other than give them anti-inflammatories? Okay. Well, we tried my slow SMART system with the kids because it was so benign mechanically. It did not hurt them. They actually liked it. And as a result, we measured anti-inflammatory responses. One of the anti-inflammatory agents or signaling proteins is interleukin 6 called IL-6. We know it, you and I know it as part of a triad that is considered inflammatory with TNF alpha and IL-10. Okay, that's an inflammatory triad. But we found through this study when IL-6, interleukin 6, is mediated by muscle contraction, it produces an anti-inflammatory global response in response to that local inflammation at the muscle site. So it makes sense. We got a fire at the muscle, a little bit of a fire, a little bit of smoke happening. What's the global response to that? Put out the fire. So now we get this anti-inflammatory response, IL-6 response. We measured the kids all vastly in their anti-inflammatory measurements. Okay. Now they felt better doing stuff. They got stronger. So things strained them, inflamed them. So it's a whole cycle of an upward mobility of upward response. So high intensity exercise produces global anti-inflammatory responses. Okay, and that is something, how rheumatoid patients, arthritic patients always say, I feel better when I do something a little bit than if I sit. Well, now we understand kind of why. When you do something, there's an actual chemical response that we can instigate through a specific application of muscle fiber recruitment. Okay, that to me is cool stuff. So we have a reason, not just, well, yeah, I feel good. Well, good for you. I did a workout. I feel better than I did. I was stiff and achy before. Now I'm not. Well, there's a reason for that. And now we can then structure, we can reverse engineer the process to say, this is how we structure this program to get you those responses, to get those benefits.
When people think of exercise, I really don't think too many people are thinking that they're getting anti-inflammatory benefits from that. The fact that they're able to suppress inflammation, especially if someone's dealing with an injury, they do know they need to exercise, but at the same time, sometimes their exercise program or whatever they're doing is making them hurt more. They can't tolerate it for the issues that you talked about,
absolutely.
like the fatiguability of muscle and the overload principle.
You know that. Well, okay, so now you have to be aware of relatively pain-free range of motion. You got to be cognizant of that. Okay, you have to be cognizant of perhaps the limitation and the flexibility. Okay, that those kind of things, sure. But you also have to understand that some of the reason why they're having this, we would consider an abnormal, exaggerated response of inflammation to what we consider everyday activities is because they don't have everyday function. So more things inflame them and hurt them than if they would have increased function, which would also increase pain-free, strong range of motion. Okay, so the artistry of our science is that we have to be able to create the condition of this muscle fiber recruitment, range of motion, speed of motion, position, posture, level of fatigue. All these things come into play, and we have to observe them and manipulate them so that we know there are outliers, and we know that everybody's a little different, although everybody's pretty much in general the same kind of a thing. So if you're a practitioner, you have to, this is where your art comes in. This is where your expertise comes in. Any schmuck can say, but do 3 sets of 10 repetitions. I'll be back in 5 minutes. I mean, what's going on? Where do you feel this? Does it hurt in this position? Maybe we do limited range of motion. Maybe we do an isometric in a position where if we continue to do a movement, it's irritating, but I can strengthen the muscle by just doing an isometric contraction in a certain position or a number of positions, which doesn't produce mechanical wear and tear and stress and irritation. Okay, so but this is still all, how do I manipulate the muscle system? And the anatomy of such a thing has a lot to do with how you apply it, not just and then again, hoping that's going to produce the metabolic response, the inflammatory protein synthesis, for muscle growth, these kind of things. So that it's, you can weeds crazy in this thing a little bit, but that's kind of what's going on.
Yeah, we can go more in depth into that. Not, we won't right now, but I'd love to have you come back and we can talk about more of the specifics of that. But that's always my main message. It's the fact that anybody can tell you to do 3 sets of 10 of a specific exercise, but you need to have prerequisite mobility. You need to have stabilization around that joint.
Absolutely.
You do more damage if you're not controlling the motion and if you don't have sufficient range of motion. And so, I mean, it's okay to work in a shortened range, but you have to realize what effect that's going to have. And so, for recovering from an injury, it's just nice to hear from you the fact that there's these anti-inflammatory benefits induced by exercise in addition to everything else. And I think to me, that's just icing on the cake, because if someone is trying to reduce pain or reduce inflammation in their body, they often, might immediately go to the doctor to get a pain medication. That's sort of the fast,
Right.
quick acting. Then second, we think of maybe doing a diet, thinking of cutting out some inflammatory foods, which is also really important. But you're just focusing only on the exercise component. And that's what, to me, is amazing. The fact that now we could also combine not only your diet and nutrition, but also your exercise program for the purpose of improving your metabolic efficiency and reducing inflammation.
Yeah, I mean, I personally, and in my practice, have always used, diet, and also have prescribed to my MD fellows what I think is a better pharmaceutical indication than maybe what they might think, only because I've seen it work better with less side effect. Again, what are they trying to do? They're trying to induce metabolic or chemical changes with their pill. Okay. Physical therapists are trying to really produce metabolic changes through mechanical means. Okay. So we're all trying to get to this chemistry that reduces pain, that reduces inflammation, and these are all in a cycle, and that upwardly mobilizes the condition of the joint, the attaching system, the muscle, the scar tissue. Okay, we're trying to induce a upward mobilization in function. Okay, without negative repercussion. I mean, it's kind of I think it's a pretty simple process.
Yeah, absolutely. So if somebody wanted to get more information from you or learn more about SMART training, how could they do that? Towards the end, I always let the speakers offer a gift to the audience or a way to get in touch with you.
I mean, I think I'm drbenbow.com. I'm on YouTube all over the place. Dr. Benbow. I have a lot of stuff on Low Carb USA on that site. And my phone number and my email are all on those things. And if people want to get a hold of me, they can certainly do it. I usually can answer most of the phone calls or emails within a couple days. I am now starting to do some telephonic training, but I don't want to get into like massive numbers of people. But I want to take like 4 or 5 special cases and work with them for a few months on Zoom. Okay, and I've started that, and it's really kind of cool, which is way years ahead of my background, but it's really kind of cool. And what I do with that is I get them a book, and then we go online. I do an assessment first time, go over labs, go over lifestyle, go over problems, go over injury, mechanical stuff. And then we start them on a program. And I don't want to have them with me for the rest of my life, because it's probably I'm 71 already. So I don't, I don't need them forever, but I that's something I really am interested in doing. But they can always get a hold of me, and I can get them. I have connections for getting discounts on equipment, on the book. I can get, whatever. That's fine. I don't mind doing that for all the people. And if it gets too busy, then I'll just YouTube it. But yeah, they can get a hold of me, drbenbow.com, drbenbow.com, and anything on YouTube. Just look up Dr. Benbow on Google. I think there's a whole bunch of stuff now. So that's the easy way to do it.
Appreciate it. Well, appreciate your time. Thanks. You are a wealth of knowledge. Hopefully everybody learned something valuable. I know I did. I know the audience will. And I think that your approach to managing pain, injury, and improving people's fitness is, ultimately going to help not only the person that's dealing with those issues, but also the professionals, also these so-called experts, like you said, because we need to hold everybody to a higher standard. Absolutely. To get better, evidence-based care for everybody.
Absolutely. Hey, always a pleasure talking to you, Mark. We'll stay in touch.
All right.